Welcome back to Inside South Florida. Prostate cancer is a disease that affects men across the country, but now, thanks in large part to a South Florida surgeon, some very exciting news, which could be a game changer, is here. Here's Dr. George Suarez. Dr. Suarez, it is so good to see you. Welcome to our show.
Thank you, David. It's a pleasure to be here.
All right, we're going to talk about a cancer that is really a problem for guys. Next to skin cancer, prostate cancer is the second most prevalent cancer for men. And if I have the facts right, approximately 1 in 38 men are going to die from prostate cancer. Is that true?
That is true. It is the most common cancer in men. It's the second most common cause of death related to cancer. I will say something. You said it's the most important cancer in men. That's correct, but it's also a very important cancer in women, because what affects or impacts a man is going to impact the spouse or a significant other. And the consequences of traditional surgery or radiation are very high incidence of impotence and urinary incontinence. So that does not just impact the man. It impacts his wife, significant other, and the children. It impacts everybody.
Sure. Okay, so there is a very exciting revolutionary treatment that you are behind, that you're at the forefront of. We're going to get to that. Before we do that, give us a little medical background on prostate cancer, why so many men get it, what are some symptoms, what we can do to potentially avoid it.
Well, 1 in 6 men are going to get prostate cancer, and 1 in 3 are going to die from prostate cancer. We don't know exactly why, and we don't know how to prevent it. All we do know is how to diagnose it early, which is by doing a blood test, which is called a prostate-specific antigen, or a PSA. And the most important thing about that is that early detection and early treatment prevents death. And when you think about 1 in 6, I mean, that's a lot. It's the most prevalent cancer. And unlike skin cancer, which is the most common, people don't die from skin cancer. People don't have metastasis, except maybe melanoma. Prostate cancer metastasis is a horrible disease. It's a painful disease. It goes to the bones, and there is no treatment. There's absolutely nothing you can do at that point.
Until maybe now, right? HIFU, let's talk about that. It is the only FDA-approved treatment for prostate cancer, correct?
Yes, HIFU, H-I-F-U, stands for High Intensity Focused Ultrasound. I became aware of it about 15 years ago, and 13 years ago I started doing the procedures. It was not FDA approved, so I couldn't do it in the United States. I was doing it in Canada. I was doing it in the Caribbean. I opened up centers in South America and in Europe, and we got FDA approval in October of last year. The interesting thing that most people don't know is that all the traditional treatments for prostate cancer were grandfathered in. What does that mean? The FDA took sanctions over treatments in 1977. So if a treatment was done before 1977, it was grandfathered in. There is none, not one single treatment for prostate cancer that has ever gone through an FDA trial. Dave, it took us 13 years. It took us 13 years and $250 million. Personal sacrifice, I'm not going to even try to tell you.
Right.
But I have to tell you, for the last 13 years, I got to know Canada and the Caribbean and Mexico and South America more than I knew South Florida.
Well, listen, a bunch of Americans say they're moving there depending on this next election, so maybe that you can give them some travel tips. But, okay, so tell us about this treatment. How does it work? And it seems like it's a lot less invasive than what we're talking about, you know, what's currently available.
It's totally non-invasive. It's an outpatient procedure. It takes about an hour and a half to 2 hours to do. It's painless. There's nothing there's no cutting, there's no surgery, there's no radiation, there's no exposure to anything that's invasive, obtrusive, or toxic. It's ultrasound energy. It's the same energy that we use to treat kidney stones. Medical terms, it's called piezoelectric energy. The energy is converted to heat. The heat causes a necrosis of the tissue that is very precise. Unlike radiation, it does not scatter. It does not go beyond that. It's GPS guided. If I said, this is the cancer in this cup will be gone without damaging surrounding tissue. It is the most amazing thing I've ever seen in all my years of medicine.
What is the success rate?
98% cure rate after 10 years, because a cure rate is not a 1-year rate.
Right.
10-year rate's what you need.
Right.
98% of men that I have treated in the last 13 years are cancer-free.
And this is for as advanced, like stage 4, like super advanced. This works for that too?
Well, no, it's really for primary prostate cancer that's contained within the prostate.
Okay.
I will tell you that I, along with other researchers, are working on using this for advanced stage 4 cancer. The cancer for prostate that has no cure, we're working on that. And I will tell you, I would say that within the next 2 years, we will have that available to the public. We've done it already, and it's for early stages, and it's so promising. It's so amazing. It's incredible.
Well, that's wonderful. Okay, if people have questions, if they want to reach you, how can they best find you?
Well, I practice here in Miami, South Florida, and my office number is area code 305-595-0199. The website that will give you information about HIFU is HIFUmedicalexpert.com. And my office will be very glad to help you and assist all patients in getting the information that they need for themselves or for their loved ones.
Well, thank you for coming on. It's exciting. It's optimistic news. We love this news. Come back anytime and give us more optimistic news, okay?
Thank you, Dave. I really appreciate it. Thank you for having me.
You got it. Yep.